In this video, we're going to talk about robot-assisted buccal fusion, or pars repair, using a spine robot. Buccal fusion for pars repair is a surgical procedure designed to treat defects in the pars interarticularis, commonly seen in spondylolysis. It involves placing screws across the pars defect to promote fusion and provide stability to the affected vertebra. The X-rays reveal a bilateral pars defect at L5, with no significant listhesis or instability observed in the forward and backward bending views. The red arrows show the fractures. The preoperative CT corroborates the findings from the X-ray, providing a more detailed view of the defect on both sides. It also allows for the identification of any sclerosis at the fracture ends, offering valuable insight for surgical planning. MRI is routinely performed for surgical cases to ensure there is no compression or other soft tissue anomalies in the affected segments. This sagittal MRI confirms the absence of any signs of compression. Similarly, the axial MRI cuts do not show any signs of compression at the affected levels. The key to performing buccal repair using a robot lies in the precise positioning of the robotic system. Unlike other spine cases, where the trajectory is more mediolateral, this procedure requires a craniocaudal trajectory. To achieve this, the robot is positioned as caudally on the table as possible, enabling the robotic arm to reach the target area effectively and align with the craniocaudal trajectory. The O-arm scan is performed following the standard scan and plan workflow. To plan the placement of screws for buccal fusion, the axis is adjusted to align parallel to the L5 lamina in the sagittal plane and perpendicular to the fracture in the coronal plane. This precise alignment allows for accurate visualization of the screw trajectory while reviewing the axial images. Additionally, the screw length can be meticulously planned, incorporating adjustments for compression of the fracture gap to ensure optimal stabilization. To insert the screws, the procedure begins with a skin incision made using a robotic arm-compatible knife. Dilator, along with sleeve, is passed along the arm guide into the trajectory, and the dilator or trocar is then removed. This is followed by creating a pilot hole with a high-speed navigable drill. The drilled path is then tapped using a tap that is 1 millimeter smaller in diameter, extending to the far cortex. Typically, the tap is passed bicortically to enable a compression lag effect, ensuring fracture compression. A guide wire is then inserted along the planned trajectory using inner sleeves to ensure precise alignment. This is followed by the placement of screws, typically 4.2 by 30 to 36 millimeters, commonly used for pars repair. The screws are advanced over the guide wire and tightened until resistance is felt, or in some cases, under fluoroscopic guidance for added accuracy. Intraoperatively, the final placement of the screws is confirmed using an image intensifier to ensure accurate positioning before proceeding to close the wound. Although not mandatory, obtaining postoperative O-arm scans is a prudent step to confirm that the screws are fully intraosseous. These scans allow for a detailed comparison between preoperative and postoperative CT images, ensuring that the fracture has been adequately reduced and securely fixed. The preoperative and postoperative scans clearly demonstrate the left and right pars defects, along with their successful reductions in the postoperative images, showcasing excellent surgical outcomes. The 3D CT scans clearly reveal well-placed implants and excellent reduction of the fracture. These postoperative radiographs demonstrate the final implant placement, captured with the patient standing during the postoperative period. With careful trajectory planning, both screws can be effectively placed through a single midline incision. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel. Don't forget to check out our other educational content for more valuable insights. Stay tuned for upcoming videos.